We need to have a serious conversation today. I'll keep it short and sweet, but this is something I have on the regular with my patients. So I thought I would share it with you. Some of you may be like, I have no idea what she's talking about. That doesn't resonate with me at all. Totally cool. It's not going to. But for those of you who it does, I'm speaking directly to you. Let's do this. I love having fun with treatment. I mean, because if you're having fun, you're going to get better. You should be trying in whatever you do: work, parenting, job, working out, eating, having fun, because that's what's going to bring more joy and happiness, less stress, all the things. But on the other hand, I am always going to be real with you as a doctor, as a friend, anything. So sometimes we have to have some difficult conversations. And this one has just popped up in my world a little too frequently lately. So I'm like, all right, I need to just have this with everyone on the podcast. So, butthole breathers, let's do this. Okay. All right. I need you to stop bringing your people pleasing tendencies into the doctor's office. You know who you are. I'm one of them. It's like you really want the doctor to be like, okay, we're on the right track, or and you're like, okay, I think I'm feeling better. I want to be feeling better. And then you go in the doctor's office and you're like, yeah, I think I'm doing better. And the doctor's like, really? Nothing else has popped up. Nothing makes, the pain worse or the symptoms worse. Yeah. I mean, and then in the back of your head, you're like, yeah, actually I do, but I don't want to tell. It's not necessary information. See, that's not for you to decide. That is for the doctor to decide what information is necessary and what's not. And to be honest, the more information you can give us, even the little things that you don't think pertain to your pain or symptoms or disease, it does. And it helps us put the puzzle pieces together quicker so we can get a game plan to get you better, to get you feeling at the top of your game. So I'm going to give you an example from years ago. I had a client come in and they responded to press ups day one. And I was like, yes, we got this. I mean, press ups are my favorite exercise. That and restarting your phone can fix 95% of your problems. I know it seems wild. Like, my husband has a joke with me. Like, if something's going wrong, he's like, did you do your press ups and restart your phone? I'm just like, oh my God, I forgot to do one of them. So let's do it. And I'm sure problem will be solved. Anyways, so they come in the second visit. I have them demonstrate to make sure they're doing it right. Cause a lot of times, you guys, you think you're doing it right and you're not. So that's why we got to get back together, whether you're doing a virtual call, whether you're doing the Elite Edge Club, whether you're a patient in the office, whatever it is, we got to double check. And even if you do a game plan, when you do it, you're going to be like, hear me going, all right, this is how you do it, just to make sure. So they were doing it right. I was like, okay, tell me how your week's been going. Have you been able to go up the stairs a little easier? Have you been able to drive easier? They're like, yeah, I think so. I'm like, you think so or so? Like, these were the things that we had written down as your goals of obviously decreased pain, but we don't only chase pain. We have to chase functionality and not just your pain. Like, your pain's important. I want to hear about it, but I also want to see how your body functions. Okay. And this is anything. So I don't know. And I was like, is there something else you're not telling me? And they just kind of looked at me and I was like, all right, give it to me. I can take it. And they hadn't gone in the bathroom in 3 days. And I was like, whoa, that's an issue. We need to talk about that. You should be going every day. And I said, you know, talk about this more. Are there any other symptoms? And they're like, oh, occasionally having, you know, some erectile dysfunction. They're like, but I'm getting old. My testosterone's getting low. Like, okay. There are so many different reasons for this. Obviously, some of them can be coming from musculoskeletal or neurological position, which I am capable of treating. But we need to get another specialty involved so we can have even more doctors on the case. So I was like, go to this person. I know them. They're going to run some tests and then we're going to put a game plan together. And thank God they did because they had a tumor growing and it was so small. We caught it in the beginning. So it was great. But releasing the pressure with the press ups was able to help them feel some relief. So they thought they were getting better and they wanted to get better. So they were people pleasing. And if I didn't press them and just listened and kind of, press them for more information, diving deeper, I would have just kept with the press ups and been like, cool, some low back pain. So you're doing yourself a disservice if you're not telling your doctor everything, even if you think we don't need to know it. Like, yes, I do need to know your pooping habits. And especially if they're affected and not normal. Same with sex life. I mean, anything you can think of, headaches, numbness, tingling, something that you weren't able to do before, or you were able to do before that you can't anymore. Or maybe another case is like, I used to have so much energy and now all of a sudden I'm going to bed at 7, which you know me, I love going to bed early. But if this is something highly unlike you, you're normally at 10 or 11 bedtime and you're going to bed at 7, you need to talk to your doctor about this. And I don't care if it's your PT, your massage therapist, so that we can bring more people who specialize in different things onto your team to help with your game plan. I can't say it enough. You have to help me help you. I can't do all the work myself. I would love to, but if you want a faster diagnosis and treatment plan and relief from your pain, disease, whatever's going on, you need to give me all the information. I can't just guess. I can't be in your head. It's kind of like, your marriage of like, come on, you got to like communicate. Same goes with your doctor. You need to communicate everything because we can't guess what's going on in your mind and your body. Yes, we have amazing tests and like amazing screens and all this stuff that we can like get it in the ballpark. But unless we have the information from the history, it's going to take us a lot longer to get there, or we might miss it altogether. And I don't want that for you. And I don't want that for your family members and friends. So please share this podcast, repost it on Instagram, because this is a PSA to everyone, especially my people pleasers and like positive people. I know so many people like this. I'm like, I've done it before. I'm like, okay, I'm feeling better. I mean, a little bit better, like 5%. And I'm like, I'm good. And then, a few weeks later, I'm like, well, back to where I started. I should have like mentioned that. So if you're struggling with something, next time you go to the doctor, let's make a promise to ourselves. If you're watching on YouTube, you can put your hand up, just a little emoji. We're going to keep that promise. We're going to tell the doctor all the information. We're not going to gatekeep and think that we can play doctor with our own symptoms because you're only going to hurt yourself in the long run. I don't want that for you. Okay? So we're all good? Awesome. Like I said, please share this with someone because I want this to help someone. And I want someone to, if they have a doctor's appointment with whoever, they're like, oh God, I do need to, I've been keeping this. And it doesn't always have to be something extreme. Like that was an extreme case, I told you. But it can help the doctor pinpoint, okay, this is more of a nerve pain. This is more of a musculoskeletal tendon pain. This is more of a chemical pain that we need to dive deeper with something else. I mean, you're helping yourself get better faster and be right the first time. So you're going to feel better and you deserve to move better, feel better, and live better. Mic drop.